Hi everybody, my name is Cynthia Teniente and I'm a nurse. I will love to talk to you about how to appropriately quarantine at home if you were exposed or if you have COVID-19. What is COVID-19? Coronavirus disease 2019 is caused by a virus called SARS-CoV-2, which affects primarily the respiratory system. Some of the symptoms from this virus is difficulty breathing, shortness of breath, fever, cough, muscle aching, sore throat, loss of smell and taste, and vomit with diarrhea. How does COVID-19 spread? Well, this virus spread from person to person or by touching surfaces where the virus is. Then you touch your face or your mouth, nose, or eyes. Now, what's the difference between quarantine and be isolated? This short video will tell you exactly what you need to know. Okay, so what should you do if you were exposed to COVID-19? Well, stay home in quarantine for at least 14 days after you were exposed. Monitor your symptoms. Stay away from other people around the house and rest and drink lots and lots and lots of fluids. What should you do if you have COVID-19? Well, stay home and do not leave the house unless you need medical treatment. Stay away from other people, even your pets, because if you think about it, you go and hug your pets or kiss your pets, then other members of your family will go and do the same. The virus can spread. Wash your hands. Wash your hands with a lot of soap and water for at least 20 seconds. Avoid touching your face. Do not kiss or touch anybody else. Don't share any cups or spoons or forks, anything like that. And wear a mask if you need to go outside or if you need to be around people. Now let's think about it. You were exposed to COVID-19 a couple days ago and have been asked to stay at home and quarantine. You started to develop mild fever and cough. What should you do next? Go to the doctor's office immediately. Call your best friend for an advice. Stay home and manage your symptoms, or do nothing. Well, you should stay at home and manage your symptoms. Most of the people who have COVID-19 have no symptoms, and or if they have symptoms, usually they're very mild. The symptoms should be mild, should be able to be managed at home. Um, so the best answer if your symptoms are mild is to stay home and try to take medication, maybe over the counter, um, rest, take fluids, stuff like that will really benefit. Now, you have been managing your symptoms at home, but they are getting worse. Now your chest hurts when you're coughing and you have difficulty breathing. What are you gonna do next? Well, A. Stay home and cry. B. Put your mask on and go to the ER. C. Do nothing. D. Hug your pet and cry. What is your answer? Well, B. Put your mask and go to the ER. Remember, even though the most of the patients or people who have COVID-19 don't have symptoms or they're very mild, many times those symptoms get worse. And when the symptoms are not able to be managed at home, you need to go to the ER or seek help. Well, stop the spread and wear a mask. Remember, even if you don't feel sick, you can still spread COVID-19. Our community needs our help to stop this virus. Thank you for listening, guys. Have a wonderful day.